Ever heard of the condition known as the silent thief of sight? Well, this is because it slowly damages the eyes and can cause irreparable damage to the sight with the absence of any symptoms. This disease is called glaucoma, and we'll be shedding more light on it on the show today. Hi Saints, my name is Marianne Ushi, and this is Catholic Faith Forum. Let's go on a short break, and when we get back, we'll be meeting my guest. Stay tuned. Welcome back, Saints. This is Catholic Faith Forum, and I am Marianne Ushi. Our topic for today is glaucoma, and I have with me here yet again Dr. Pintos Egesimba. Thank you so much, Doc, for coming again
No problem.
on the show. I really appreciate it. Okay, how are you doing today?
I'm fine. I'm doing all right.
Okay, I can see you look good.
Thank you.
Okay, so Dr. Pintos is a general practitioner working in Lagos. She graduated from the College of Medicine, University of Lagos more than half a decade ago, and she currently has interests in preventive health and medical communications. Once again, thank you so much.
No problem.
Okay, so today we're talking glaucoma. Yeah, so October 12th is World Sight Day, and I just thought of it. I said, let's talk about, something relating to the eyes. And glaucoma happens to be very dear, not really dear, but, close to home.
Personal.
So dear. Yes, personal for me. So can you please describe glaucoma in the way that you would to a child?
Okay, thank you for your questions. Okay, so glaucoma is basically, I say basically a lot, it's simply,
I do that too.
So it's simply a disease affecting the eye, especially the person's vision.
Okay.
So what happens, two things could happen. So either one, there's something that we call a nerve. So everyone has a nerve. That's how you kind of feel things when you touch your body. So inside the eye, there's also a nerve that helps with sight. Yeah. That also helps you to be able to see colors and differentiate places and all. Okay. Basically, helps with your sight. Yeah. So that nerve is called the optic nerve. So everyone has it. It's at the back of the eye. So what glaucoma does is that it affects or damages the nerve. So when it does that, then it won't be able. So when it does that, it starts to work to reduce the person's vision until the person, so if not treated, the person might go blind. So that's one way that glaucoma it affects the nerve. And the second way is so inside everyone's eye, there's a bit of fluid in the eye. So what that does, that fluid helps to supply nutrients to the eye. Also helps take out any dirt products. So it's going in a cycle. Then the eye brings nutrients to the eye, takes out dirt from the eye. So if that fluid is more than the eye, because the eye has like a space. So if it's being produced more than the eye can take, then it can cause damage to still going back to damage to the optic nerve and cause glaucoma. Or if the dirt products or the fluid is not being allowed to cycle out of the eye, so it's stuck in the eye, so that will cause it to build up and then cause glaucoma as well. So those are what will happen. So
basically, we can say that glaucoma is damage to the optic nerve.
Yes.
Okay. Yeah. Wow, that was very. Sometimes you read about these things online and then you're still wondering, what's going on? Well, I still don't get it. But now that you've explained it, I think I have a better understanding of it. Now, what could cause all of this? Yes, you've mentioned the fluid, not getting too much in the eye and not taking out dirt and all of that. What other things cause glaucoma?
Okay. So primarily, so glaucoma, so there's no particular cause for it, but there are some conditions that could predispose. So these conditions so it's not like if you are exposed to them that you will immediately get glaucoma, but they increase the risk of you coming down with it. So things like, basically, simplest one is an accident to the eye. So blunt trauma, if someone punches your eye and it causes, it goes far enough to actually affect the optic nerve at the back of the eye, or if there's chemicals, so maybe some sort of acid or something getting to the eye, it can also cause the glaucoma or cause that fluid buildup that will now affect the optic nerve. Also, sometimes you'll notice, so apart from chemicals like objects or maybe glass or something that can cause trauma, so basically trauma to the eye, so either through chemical or blunt or an object or a foreign body getting into the eye. Also, another thing that can cause that is surgery. Some people might have some eye surgery to maybe correct their sight or their vision. That can now mistakenly affect the optic nerve and then cause the glaucoma. So those are really the main causes. There are some risk factors, but those are like things that were put on, like having this, being exposed to this thing increases you coming down with glaucoma.
Okay, it's time for us to find out who our saint of the week is. Do not go anywhere. We'll be right back.
Our saint of the week is Saint Josaphat. Saint Josaphat was born John Kunchevich about 1580 in Vladimir, a village of the Lithuanian province in Volhynia. His parents belonged to the Eastern Rite Church of Kiev, Ukraine, which was then separated from Rome. When John was just a child, his mother explained the icons in the church. Years later, he told a friend that he felt a spark of fire leave the wound side of the crucified and enter his own heart, which filled him with so much joy. This event influenced the rest of his life. He began to memorize the church rituals and psalms. Within him grew the desire to suffer poverty and death for his Savior. John's father sent him to Vilna in Lithuania to learn more about the family business. Nevertheless, he spent much of his leisure in reading the lives of the saints and observing the religious ferments in the local church. The Ruthenians, the ethnic origin of his family, had been evangelized from Constantinople and generally followed the lead of the Byzantine church there. But because of the absorption of the Ruthenians into the Polish kingdom, which is staunch Roman Catholics, the question of reunion with Rome was hotly debated. The bishops of the Ukrainian and Belarusian churches, who lived within the Polish-Lithuanian Commonwealth, held a Ruthenian synod in 1595 and voted to unite with Rome under Pope Clement VIII. John Kunchevich was then 15 years old. In 1598, 7 bishops signed the Union of Brest, which allowed them to retain their Eastern rites while in full communion with the Pope. Although most of Vilna refused union, John made his profession of faith, then entered the Basilian Monastery of the Holy Trinity in Vilna and took the name Josaphat. Josaphat was made the superior of a daughter monastery at Byton, where he revived devotion to the Mother of God at Zervotia. Returning to Vilna as archimandrite of the monastery, he began to reform the monks. There, he also compiled texts from the Eastern Fathers and Doctors under the title, A Defense of Church Unity. All these activities led to his being appointed coadjutor bishop to the elderly, ailing Bishop of Plock. Subsequently, Josaphat became the Bishop of Plock. The new appointee at once called a synod to revitalize his diocese. He detached his priests from subservience to the unruly nobility and wrote a rule for priests. Most of all, he pursued the reunion of all with Rome. In 1620, Josaphat thought about the commencement of attacks that would result in his death as hostilities between supporters and opponents grew more heated. He protested, "You people of Vitebsk want to kill me. You set up ambushes for me everywhere, including the streets, bridges, motorways, and shopping centers. You should be aware that I am serving in your midst as a shepherd and would gladly lay down my life for you." While Josaphat was visiting Vitebsk, Belarus, he was cruelly hacked to death on November 12, 1623. He was about 45 years old. Josaphat had said before his martyrdom, "I rejoice to offer my life for my holy Catholic faith." Interestingly, the Orthodox Archbishop Meletius, the saint's former adversary, eventually reconciled with the Catholic Church. In 1867, Saint Josaphat was canonized by Pope Pius IX. On November 12, 1923, the 10th century of Josaphat's martyrdom, Pope Pius IX declared him the heavenly patron of reunion between Orthodox and Catholics. Saint Josaphat, pray for us.
Okay, welcome back. I hope you enjoyed that talk on the Saint of the Week, and I hope you emulate the life of the saint. Now back to our topic on glaucoma. I want to find out, can children have glaucoma, or is it something that just only occurs in adults? Because I'm going to give you why. Because I know someone who's like in her teens, and she has been said to have traces of glaucoma. So I want to find out how that can be possible.
All right. Okay. So children can actually come down with glaucoma or they could be, so mostly in children, they're usually born with it. So it's something, we call it congenital glaucoma. Okay. So that's like so when I mean children, I mean like babies, like about maybe 1 year old, 2 year old.
Wow.
So yeah, so obviously they won't say that, oh, something is going on with their vision or definitely anything, because one of the reasons why glaucoma is such, we say a silent thief, is that there are no symptoms until it's like in the progressive stage where there's some damage already in the nerve. So for young children, what you will notice is that they could be having excessive tearing from the eye, but they're not crying. Just that notice that tears are coming down from the eyes. They could also be very sensitive to light. Then blinking excessively. Those are like children I'm thinking of children that cannot speak or say anything that, oh, my vision is blurry or anything like that. But you notice that they can also be rubbing their eyes excessively. There's no irritant or anything in their eye, just be rubbing that. So when you notice that in a young child, then you might need to have their eyes checked. Okay. So when they mean traces, so like I said, glaucoma you won't have any issues until you notice some symptoms. So when there's been some damage to the optic nerve. So it could be as minimal as okay. So one of the things that you notice, for adults that can speak, one first thing that they will notice is that their peripheral vision might be reduced or might be lost. So I mean peripheral vision is basically, so as you are looking straight now, you can still see some objects at your left and your right without having to turn your head. Yes. But when that peripheral vision is lost, most people won't even notice, because they'll be automatically, your brain will help you compensate by making you turn your head anytime you have to look at your left or have to look at your right. So the easier way to check for this, or simplest, this is not scientific. It just is to, if you can put your hands like beside your head. Okay. So you're looking at the peripheral vision. So you can only just see what's ahead of you. So people that have glaucoma at the early stage, something we call tunnel vision. So they can only see what's ahead of them. They can't see what's left and right. So,
but if I do this, I can't see what's left.
And so that's like that's for you to like, okay, this is how that vision is. So if we do this,
okay, oh wow,
if you do this and then you take and you can't see, and then your vision comes back, okay, it's fine. But for them, that's simply for them to notice that, okay, oh, I really can't even see because their brain would have compensated before by allowing them to turn left or right and so.
Oh wow!
That's one of the earlier symptoms.
Yeah, so children can have it.
Children can.
All right. What are the risk factors that can lead to glaucoma?
Okay. Well, unfortunately, for us Africans, for some reasons, being African, being African American, being Hispanic, so race is one of the highest risk factor. About as much as, well, like 5 times more than people from other races.
Just
and then
for Africans.
And then even having a family member as an African increases your risk by 20%. So it's like a lot so race is one of the things that history. Yes. Then also age. So older, like I said, everybody can get it, but being of older age also predisposes people to having glaucoma. Then having a pre-existing eye condition, so either extreme, so long-sightedness, short-sightedness, but not just the mild one, like maybe those that really maybe +10 or -10 in their vision. So having extremes of the long-sightedness or short-sightedness can also predispose them to having glaucoma. Then other eye conditions that include a cataract, having a cataract as well can also predispose someone to coming down with glaucoma. Then, like I said, injuries to the eye, so continual injuries to the eye, or if you had surgery before in your eye. So that can also predispose you to having this. And then those disease conditions that were mentioned earlier, so diabetes, hypertension, can also predispose someone to coming down with glaucoma. Then an eye infection. So having, like I said, there's either damage to the nerve or buildup of that fluid. So some people have like eye infections.
Yeah.
So I'm not talking about conjunctivitis. I'm talking about infection into the eye. There's something we call uveitis. So that is around the iris, which is where the color is. Because that's where those channels that take out the dirt, that's where they pass through. So if there's inflammation around there, it can cause it to block. It can cause blockage and then cause you being close to glaucoma.
Wow, a lot. Okay, so we've said that there are no symptoms, but I just want to, because it's just weird that there are no symptoms, not even any pain, nothing at all until there's a damage.
So yes, there won't be any pain. So let me say, okay, if it's for like the more common one, there's no pain. It's only when the damage has been done, they might start feeling some pain. But like I said, the very simple and the earliest symptom, but that's even when there's already damage, is that loss of the peripheral vision. But some people might also notice that there might be some patchy, they might notice some spots or dots in their vision as well. And so that's not maybe when you were lying down and you stood up quickly, or you were spinning around or looked at the sun and looked away. That's not the kind of patchy that we're talking about. It's just, you're just doing your normal thing and then you notice that, oh, my vision all of a sudden got blurry, or there are little patches on it. So that's something to be worried about in terms of, so basically, but there won't be any pain. But there's a type of glaucoma that we call acute glaucoma. So what that happens is that, so that pressure or that damage is ongoing. You won't feel anything, but then it will just suddenly close up those, suddenly build up, and then people have like acute symptoms. So basically, they'll start having pain. They'll notice that, oh, they are seeing like rings of light, they're seeing like rings around lights. They'll redness of their eyes, might even feel nauseous, might have headaches.
And all this just happens suddenly.
So that's a medical emergency when people come down with, so that we call that acute glaucoma. But typically, most times it just progresses, and then they're not noticing the changes in their vision.
All right, thank you for that clarification. All right, it's time for us to meet our Know Your Faith crew for our faith session. Do not go anywhere. I'll be right back.
Have you ever wondered why Catholic priests raise their hands over the people when praying? Hello, people, and welcome to Know Your Faith series. I am Elefachi. First of all, the act of extending hands when praying by the priest is called the orans posture. Orans means praying, and this posture is used when he's praying on behalf of others. Now, when the priest is leading the people in prayer, he will often hold out his hands, and this indicates he's praying for everyone present. The priest usually uses this ancient prayer posture, extending his hands to his sides and slightly elevated. It symbolizes Christ's outstretched arms as he offered himself on the cross. You may also have observed some people extending their hands in the orans posture, usually during the Our Father prayer. Is this right or wrong? The orans posture, as we said earlier, is a priestly posture of prayer over the people. It is not a posture for the lay faithful during liturgical prayer. The right posture to assume during the Our Father prayer is to put your hands together and say the words of the prayers along with the congregation. So, the next time you're at Mass, watch the priest's gestures closely. Anytime he offers prayers on behalf of the faithful, he uses the orans posture, and anytime he's offering other prayers, his hands are folded together. I believe you now know why the priest raises his hands when praying, so you won't be tempted to join him in that. That's all for today. Feel free to subscribe, like, comment, and share. Till next time, Be bold, be Catholic.
Welcome back. Yes, thank you so much, KYF crew, for that faith session. Back to our topic, glaucoma. Now, how can it be treated? What are the ways that, people who have it can, is it possible that they can, be cured from it and all of that?
Okay, so, before we talk about treatment, let's talk about how do we diagnose it. Okay, so basically, diagnosis is through an eye examination. So you can't, so you might have all those symptoms, but it could be something else. So you can have that loss of vision or something. So it could be something else that could cause that. But diagnosis is you go to the hospital, the doctor looks at your eye. So they're checking several things. They're going to check your visual acuity, which is the simple test that we do when we want to check our eyes at the hospital or want to get glasses. So they'll actually cover your eyes and then read that. So we check for that. They also check for your peripheral vision. So basically, they're going to
put you inside one. I've done it before.
Yes, and then check if you can see all the way, see the different areas. Then they'll also measure the pressure of your eye. So like I said, it's either your vision is going from the damaged optic nerve or that there's an increased buildup of pressure in the eye. So they'll use a device. So it's just they put it on the top of your eye. So it doesn't go in your eye. It's not painful, but it might be uncomfortable because you need to keep your eyes wide open. But before they do that, they'll usually dilate your pupil. So they'll put an eye drop so they can actually look behind your eye for the eye test and then also check the pressure check pressure in your eyes as well.
But they do that one when you did not pass the formal test.
No, they do everything. Yes, because they're supposed to.
I need to go back and come.
Yeah, so they need to check your pressure, and then also there's some other things that they do. They might do some imaging scan where they'll look at the optic nerve itself and see if there's any damage to it.
Okay.
As well. So that's basically how to diagnose it.
Yes.
Then treatment. So for now, there's no cure for it. So it's rather detected early and then managed so that it doesn't halting the progress of it, so it doesn't now affect the person's vision. So if the person goes to hospital, your pressure is quite high, so they will start you on medications that would help to. So medications could include eye drops that help to help you to reduce the amount of fluid in the eye.
Yeah.
So there's no medication for now that would heal the optic nerve, because that would have been the cure.
Yes.
But it's rather will prevent any more damage to the optic nerve. Then it also would reduce the pressure in the eye. So either medications, so eye drops, oral medication that you can take. Then there are also some other newer treatments, like surgery. So what the surgery is doing is that it's helping to create like a small hole where those excessive fluid or the pressure in the eye can be draining out. So not like you would see
draining outside or inside.
No, it's like your body will have a way to get rid of it. So it's not like you're going to be crying or having excessive tears. It just helps to reduce those things. And there's any inflammation in the eye also helps to stop that as well. So basically, that's
medicine, surgery.
Medicine, and then laser surgery.
Okay. Yeah, so is it possible that when you do all of this treatment, you would avoid it getting to that point where you completely lose your vision, or is it that all glaucoma must lead to loss of vision?
Okay, so no, because it's one of the things that I would say it's a something that is a treatable or preventable cause of blindness, meaning that if you stop it, detect it earlier, and then make those provisions, so use those medications to stop it, then your vision will be preserved.
Okay.
So that's one of the mainstay of treating it or taking those medications to preserve your vision. So it's not like no matter what you do, you're still going to know. That's not it.
So we can arrest the silence.
Yes.
Okay. That's good to know. All right. I've heard that glaucoma is more aggressive in Africans, and you also mentioned it here. But I want to know why exactly. What is it in Africa or America? You mentioned
African Americans.
Yes.
Okay.
So what is it?
Oh, for now, they're doing some studies. There's still some research on it, but so far they've put forward some theories. So one of them is that there's some sort of genes in African Americans that cause us to have glaucoma or makes it more aggressive in Africans. Then also they also speculated that our corneas, which is the white area that you see, though it's not white, but they are
supposedly white area.
Yes, is thinner in Africans than other parts also, and that predisposes us to coming down with glaucoma. And then also the lack of, how do I put it? Well, the other things that could risk factors, so not wearing enough, being exposed to chemicals that could affect the eye, not protecting the eye when I'm working with like things that could leave like little bits and distance. So
Yeah,
like
all
that.
those
But
other ones.
basically,
So it doesn't have anything to do with maybe the fact that Africa is hot or we're black.
No, none of that. So.
All right, no problem. All right, now finally, since it is majorly asymptomatic, how can one find out before it's too late? Because, you know, we call it silent thief of sight. But hello, I don't want you to steal my sight. So what do I have to do in order to make sure that...
So test your eyes. So eye testing, going for those tests, so that doing the visual acuity, checking the pressure of your eye should be something you do yearly. So it doesn't have to, it's not age related. So everyone should have their eyes checked.
Yeah.
They couldn't see other things from the, but you should have your eyes checked. So as long as you're sure that, your eyes are fine, your vision is normal, the pressures in your eye are between normal. So typically when they measure the pressure, normal pressure is supposed to be between 10 to 21 millimeters of mercury in the eye. But for people that have glaucoma, it can get as high as 70. So you can imagine from 10 to 70, 7 times more. So you can imagine what the eye is even going through. So having your eyes, so the best way to know that is having your eyes checked. So have an ophthalmologist, have a physician that you see to let it be part of your routine yearly screenings. So just, as you're checking, doing a mammogram for women and all that, or prostate scans for men and all that, then also
remember the eyes.
Yes, because the eye is the window. Is the window to the hole, so
yes,
you need it. So
okay, so there you have it. Regular eye checks. That's what you need to do at least once a year. Just go and let them check your eyes. Check everything about the eyes, you know, to make sure that you don't have any particular eye condition, not just glaucoma. Thank you so much, Dr. Pintos.
You're welcome.
Amazing, amazing. Sometimes I'm like, how is it that medical doctors, you know all of this? And then I remember, you guys studied for 7 years. Must have been something. But yeah, thank you so much for enlightening us, sharing from your wealth of knowledge. I really appreciate, and I hope that when I call on you again, you will answer me.
No problem.
All right, guys, that's our show for today. If you have any questions, comments, suggestions, drop them in the comment section. Do not forget to subscribe to our YouTube channel at Dominican Media Presents, and also share this video. You don't know who needs it. Yes, also we're on social media at CFF on TV. Do not forget, my name is Marianne Ushi. Until next time, keep being saints in jeans and shirts. Bye. Wave to the camera.
Bye.